The faculty here I would describe as very supportive and enthusiastic. They love to teach. They really encourage us to take ownership of the patients so that we feel like we really are making the decisions for our patients. I selected Hurley for my residency because I liked, one, the community atmosphere. I felt that the physicians here, along with the nursing staff, the whole team really cared about their patients, and they have a very patient-centered approach. Hurley's mission statement is that they will not turn away anyone from inability to pay. So people that might have been denied surgeries or care at other regional hospitals end up coming to Hurley for care because it really is our mission to take care of all patients. Unfortunately, when people are denied access to care other places, their conditions advance to stages that you might only classically see in the textbooks. Well, you see them in our patients, unfortunately, because many of them have not been able to get care elsewhere. Right now, at least for our training purposes, it is educational value because we know how to treat things that, if we move to a rural area or to a larger city where everyone primarily has health care, they may not be as familiar with it. So we have a very dedicated, sophisticated ultrasound unit where residents actually have the opportunity to interact with high-risk patients on a day-to-day basis. We're able to get training in amniocentesis, amnioreduction, cerclages, lots of hands-on procedures that other people don't receive that training until fellowship. Also, from the gynecology aspect, we're able to rotate at hospitals that do have robotic surgery. Here we have lots of laparoscopic surgery. Again, things that other residents don't get exposed to as early on, we're able to see those all 4 years. Michigan State University's College of Human Medicine has a 3rd year and a 4th year clerkship here at Hurley. So we're interacting and getting and are able to teach on a daily basis. In terms of research, we have a wonderful research department that will help us with chart reviews so that if you have a project, you take it to them, show them your idea, and they'll help you make it happen. We're very supported from an educational standpoint. Just make sure that you're open-minded, make sure that you're able to deal with all sorts of people, just because that's not only a skill that will help you at Hurley, but it's going to give you training for the future. A lot of times patients come from different walks of life, and so you need to be open to accepting people from all backgrounds and not just what you're familiar with. The other thing is, I would say, be prepared to learn, and that's not a bad thing. You should be prepared that you're going to see lots of stuff, more stuff probably than you thought was possible to see, in a residency lifetime you will see at Hurley.